MMT, hip flexion, abduction, external rotation with knee flexion, sartorius. Assist the patient to the short sitting position with the thighs fully supported on the plinth and knees flexed to 90 degrees. The patient's feet should be on the floor or resting on a stool. Patient may use the arms to provide trunk stability by placing the hands on the plinth at each side. Stand slightly in front and to the side of the leg being tested. Passively move the patient's hip through flexion, abduction, and external rotation as you flex the knee. You are not assessing the infield, you are determining how much range the patient is able to move in this direction so that you can appropriately assign a muscle grade. In patient-appropriate language, ask the patient to flex, abduct, and externally rotate the hip and knee flexion as you observe for any substitutions. Make sure the patient is stabilized by placing their hands on the plinth. Please note that it is not necessary to have the patient perform the active motion twice if no substitutions are observed on the first attempt. You may apply the resistance at that point. Common substitutions include the use of the iliopsoas or rectus femoris, which will result in hip flexion without external rotation and abduction of the hip. Make sure the patient is not leaning the trunk posteriorly to aid with hip flexion. After correcting any substitutions, ask the patient to perform the motion as previously. Make sure the patient is stabilized by placing the hands on the plinth as you apply a force at the lateral side of the knee and the medial anterior surface of the distal leg. The force at the lateral knee should be into hip extension and adduction, down and inward. The force from the distal medial anterior leg should be into internal rotation and knee extension. Apply the force for a 5-second count. Grade 5, normal. The hip flexed, abducted, and externally rotated, and the knee flexed to the available range of motion, and the patient was able to hold against maximal resistance with no break in the position. Grade 4, good. Hip flexion, abduction, external rotation, and knee flexion holds against strong to moderate resistance. There may be some give at the end position. Grade 3, fair. The patient is able to move through all the available range of motion in hip flexion, abduction, external rotation, and knee flexion, but is unable to tolerate any resistance. If none of these conditions are met, you must reposition the patient into a gravity-eliminated position. Assist the patient into supine with the heel of the limb being tested on the contralateral shin. Make sure the trunk and pelvis are in neutral alignment. Stand at the side of the limb being tested. Support the limb as necessary to maintain alignment. Ask the patient to slide the heel up to the knee. Grade 2, poor. The patient is able to slide the heel up to the knee in the supine position. Stand at the side of the limb being tested, slightly facing the patient. With the hand that is closest to the patient, cradle the test limb under the gastroc so that you are supporting the leg behind the knee. Use your other hand to palpate the sartorius on the medial side of the thigh where it crosses the femur. You may also palpate near the muscle origin just below the anterior superior iliac spine. Ask the patient to attempt to slide the heel up the shin toward the knee. Grade 1, trace. There is partial range of motion or you are able to palpate a contraction of the muscle. Grade 0, no palpable contraction.